Welcome, everyone, to another edition of SCRC's Let's Talk Caregiving. I'm your host, Roberto Velasquez, President and CEO of Southern Caregiver Resource Center. And I'm here, as always, with my co-host, Marta Rañón, our Executive Vice President. How are you doing today, Marta?
I'm doing great, Roberto. So happy to be here.
All right. Well, today we have a very special guest. Her name is Cheryll Kidd. Cheryll Kidd has been a registered dental hygienist for 9 years and became a registered dental hygienist in alternative practices in 2023. Inspired by caring for her grandmother with dementia, she started a portable practice serving elderly and disabled patients. She is also pursuing her registered nursing degree to expand her ability to care for her patients' overall health. Welcome, Cheryl. Thank you for joining our podcast today.
Oh, thank you for having me. I'm so happy to be here.
Cheryl, I'm really interested to hear from you about this line of work that you're doing because, as some of us who are caregivers, we often focus on the physical limitations that the person that we are caring for have, right? They might have limited mobility issues. Maybe they need a lot of assistance with activities of daily living. Of course, we talk a lot here about cognitive decline and identifying some of those symptoms. But I feel that oral hygiene is one of those that we don't really mention. I don't know why that is. Can you talk a little bit about that, Cheryl?
Yes, you are definitely correct. I feel like oral hygiene is one of those things because since we do have a difference between medical insurance and dental insurance, that people tend to really focus on dental as being an entirely separate concept. I feel that people have separated oral health and their medical health as two separate entities, and they don't believe that there is a connection between the two, that one doesn't affect the other or vice versa. And because we don't consider that within our own health, we don't tend to think about that when it comes to taking care of our loved ones as well.
Yeah, Cheryl, I want to go back to something you just said: insurance and the cost of dental hygiene and dental work, and a lot of people also are very deterred from going to see the dentist or just getting that service because everything costs so much money. It's almost always out of pocket, right? So it makes it a bigger barrier, even and on top of what you were mentioning, that people separate, good dental hygiene with physical health for the whole body, right?
Exactly, exactly.
I also wanted to mention that as we, as caregivers, many times we're so focused on the person that we are caring for that we also neglect our own needs, our own care, right? And oral care is one of those, right? I'll go to the doctor when I have a pain, but I don't necessarily go when I need to prevent something, right? I mean, that's a lot of caregivers' mentality because we're so busy. And but what we know is that, and of course you can share with us, is that when we neglect our oral health, it can lead to a lot of other illnesses or conditions that are then become a bigger problem down the road. Would you agree with that, Cheryl?
Yes, I would definitely agree with that. It has been shown in multiple studies that gum disease in itself can increase your chances of heart attack, increase your chances of stroke. It can also lead to worse kidney dysfunction, dementia, Alzheimer's, diabetes, pregnancies, complications, all sorts of issues for the rest of the body.
I think it's also really important to note, and you were inspired by being a caregiver to your grandmother who also had dementia, that it's important to have specialists that focus and work with people with dementia because it's a very different population, right? I mean, it maybe the person is not able to follow instructions well. Maybe that person gets agitated. Maybe the medication that they give them to sedate them affects them differently because they're on other medications to help with behaviors or other chronic conditions that they might be having. And the fact that, they might be at a dentist's office and get frightened or not understand, what's happening at the moment. So I think it's important to have individuals that are specialists in working with dementia. I know in the physician world, that is the case. If people aren't geriatricians or they don't have experience working with dementia, those physicians often have a much more difficult time with these patients.
Yes, exactly. That is actually what registered dental hygienist in alternative practice is. We specialize. So once you are a registered dental hygienist, you do that for 2,000 clinical hours, and then you are able to go back and you can take a program that specializes in understanding patients that have different special needs, intellectual disabilities, different disorders, whether it be cognitive or physical, and you learn how to treat those in specific. I actually went into this after I was taking care of my own grandmother for 6 years. She was one of those patients with dementia that was a little more agitated and it
Hmm.
was very difficult to bring her into a dental office. She often would fight with the other clinicians because it wasn't familiar to her and that sort of a thing. So I took it upon myself to work on her oral health care in the home. And I actually had one of our nurses come in and they were doing an overall assessment of her health and they checked her mouth and she told me that my grandmother was one of the few patients she had ever seen to have such great oral health care. And I asked her, why do you think that is? And she says, I don't believe many caregivers or there's many people that are working on the oral health care of these patients.
Way to be an advocate for her, Cheryl. That's amazing. I think that is really commendable that you took that upon yourself to do that for your grandmother. And I know that a lot of caregivers do want to do the best that they can, but something like this is very limiting, right? Right? I mean, just because my, let's say, grandmother has dementia, I'm not going to be a neurologist and I'm not going to be a gerontologist to try to help her. But then that's why we need to know, and that's why we're having these conversations, to know where to take the people that we are caring for, to people like Cheryl to really help us evaluate the situation and give us that support that we need, because like Roberto was saying earlier, sometimes these services are not covered. Sometimes caregivers don't know where to go for these type of services. I know when I was a caregiver and I was caring for my great aunt who had dementia, she was elderly and she needed assistance with activities of daily living. Oral health, it was not in the forefront of my mind. It wasn't the thing that I needed to focus on because she had so many other issues. So I know that caregivers knowing about this is really important, maybe can help guide them as they are going through their caregiver journey.
Cheryl, thank you, Marta, because that's really important. And you bring up your grandmother and caring for somebody with dementia, and that's like sometimes the last thing on your mind is their oral hygiene. You're dealing with behaviors, you're dealing with sundowning,
Hmm.
you're dealing with wandering, you're dealing with inappropriate agitation that can even be embarrassing out in the public. So you're really not, whether she brushed her teeth or not, you're not. Those are things that you're not really too concerned with at those moments. But it is important, as Cheryl's talking about, and it's related to other conditions that could be chronic and disabling as well, with heart disease and other things, with gum disease and so forth. So, Cheryl, do you have tips that you could share with other caregivers who are listening in today about, some tips that they could use for oral hygiene for the loved ones that they care for?
Definitely, definitely. So some tips that I would have are definitely use the use of an electric toothbrush. I think that's one tool that is definitely underlooked. I still in the dental office get from patients who are healthy that they find that electric toothbrushes are like a quote unquote scam. But really, the studies have shown that electric toothbrushes can do more than we can do by hand, especially if you have someone that's fighting back with you and you can't get a manual toothbrush in there to get the amount of strokes that is necessary to remove the biofilm that is causing the gum disease. If you have an electric toothbrush, it's doing the work for you. You just have to work on getting it in there. And now, in that regard, that's where I would also recommend using something called a mouth prop. You can find these on Amazon. There is a special website called specialcaredentistry.com where they sell kind of like it's a styrofoam mouth prop that is of various sizes that you get them to open up as much as they can because for some of them certain medications only allow them to open a certain width. Using the smaller end, you go in horizontally and then you turn it vertically so that you get more of a space, and then that lets them relax their jaw on the mouth prop, and then you go in with the toothbrush and that sort of thing. Now, when it comes to flossing, I would definitely recommend what's called a water pick or water flosser. They're also known as hydro flossers. With these, it's basically shooting high pressure water in between the teeth. And a way to make this more effective, instead of using just water within the machine, you can dilute it with a non alcoholic mouthwash. You can also put just a couple capfuls of hydrogen peroxide so that you're getting antibacterial in there. And that is just killing anything and everything. And as well as like food debris, you can use that after meals. You would just want to have the patient leaning forward as you use it, and so that they're not ingesting or swallowing the liquid.
Hmm.
Cheryl, what about individuals with dentures or partial dentures?
Yes, definitely. There are ultrasonic cleaners. One of my favorite brands is Zima. It's basically just a little pod that you fill with water or fill with the little denture tablets in water. And then you would place the denture in there, let it run its cycle. Sometimes it can be 20 minutes, sometimes it's only 10 minutes. And I would do that at least once a day. If getting those ultrasonic cleaners is a little kind of out of the budget, just getting a cup that you put, again, a couple capfuls of hydrogen peroxide in and letting the denture soak overnight. One big thing I must point out with that is that dentures need to be taken out every night. Patients should not actually be wearing their dentures 24/7. It's really only for them to eat or for cosmetic reasons, of course, but keeping it in there 24/7 actually can harm the gums and cause more inflammation that I don't think many people realize.
And Cheryl, and I'm hogging up the time here, Martha, because I have all these questions.
Okay.
So fascinating. This information so great to hear from
Yes,
Cheryl. I
it is.
appreciate it very much. But in my intro, we talked about your portable practice. What is that? Is that like a mobile dock? I mean, what does portable practice mean for you?
So I use the word portable versus mobile because when I say a mobile practice, most people think of this van that I drive around and I have like a little dental office in the back and you have to kind of wheel them in. But it's nothing like that. It's completely portable. I have a unit that has all of the things you would think are in the dental office, including it has an air compressor with a suction, air water, that sort of thing, its own water and waste reservoir, and it's on wheels. So I just roll it into whether it's the home or the skilled nursing facility. I can roll it up to their favorite recliner, their wheelchair, their hospital bed, so that I'm directly next to them like I would be in the dental office and do their cleaning exactly how it would be as if they were in the office.
That's wonderful. That's such a convenient way of getting this service for the care receivers, but also for the family caregivers. It's so difficult to try to get the person that you're caring for, especially when they're so limited in either their mobility or their cognitive, there's cognitive decline. To try to get them to go to the office ever so often and add another doctor's appointment, it's just too much. And so the fact that you are able to do that wherever they are. That is so convenient. And I don't know if a lot of caregivers know about this. And so that's why I think it's important that as caregivers, we find out what's available to us in the community.
Yeah, and Martha, yes, and I wanted to also say that this resource, this portable dental hygienist work that you do is so relieving for the family caregivers because I mean, I wish that everybody could use a mobile doc or a mobile or portable dental hygienist because it is such a chore sometimes. And we hear from family caregivers all the time when they're just trying to take them to a doctor's appointment, the fight that goes on before the event. And many caregivers have to kind of persuade their family member or even give little white lies and saying, we're going to go to lunch, but hey, but first we're going to go visit your doctor. Right. And so there's a lot of this back and forth behavior stuff. Whereas if somebody were to come into the home, wow, what a big relief.
So, Cheryl, what is it that our listeners who are out there who are caregivers, what would be the next step for them now that they know that this service is available? How can they go about accessing something like this?
And what kind of insurance accepts this type of service as well?
Those are both great questions. So right now, the current directory that has a good amount of RDHAPs, I'll shorten it for you,
Hmm.
is called rdhapconnect.com. You can look, there is a directory on there where they can put their county, city, and kind of find RDHAPs in their area, and it has all their contact information, including their phone number, their website, how the best way to get in contact with them. But also, I actually just recently found out the California Dental Hygiene Association is also starting their own directory since they have more access to our licenses and where we are. They are putting a directory together that you can find on cdha.com. There should be a directory tab that you can look for RDHAP, and that will show you a list of like areas. It also includes what languages we speak and that sort of thing. So you can kind of find the RDHAP that would work best for you.
Cheryl, what does that mean, RDH? That is the alternative dental hygiene program?
Yes, so that is the
Okay.
registered dental hygienist and alternative practice are the RDHAPs. And also the way that we are paid, unfortunately, some insurances do not consider us as providers still. So some of us have signed up for these insurances, but I will say a majority of us are fee for service and usually get paid in that way. But we try to keep our fees reasonable, knowing that many of our patients are also paying for a lot of other medical and caregiving services
Hmm.
as well.
Does Medicare cover any of this? Do you know?
Dentacal does cover some cleanings, but I will say, unfortunately, Dentacal is still at the like 1970s pay rate. So most of the RDHAPs, it's very hard to continue our services with the fee payout of that. Sometimes if you do have a PPO insurance, we can bill as an out of network provider where you will get reimbursed on the back end, but usually fee for service is the way to go.
So the best thing for a client to do or a potential client to do is to look up within their insurance provider whether it's covered the RDHAP coverage, which is the portable or the alternative service for dental hygiene.
Correct.
Okay. Wow, this is such wonderful news, don't you think, Marta? I mean, I
Absolutely.
I've never heard of this, and I just love it. I've heard of mobile docs, I've heard of other kinds of services, but the specialty in dementia and other areas is really a refreshing thing to hear that occurs in dental hygiene, and how important that is to people to have good dental hygiene, especially when you're dealing with caregiving and you're dealing with somebody with some either special needs or Alzheimer's or other forms of dementia, and how important that is. And we got to make sure that we're not only taking care of their health physically, but also their teeth, right? The oral hygiene, so important for these individuals, for everyone, actually. Well, that's all the time we have left for this edition of Let's Talk Caregiving. To hear more of our podcasts, follow us on your favorite podcasting platforms or visit our website at scrc.care. I want to thank Marta for co-hosting another important discussion, Cheryll Kidd for joining us today, and our audience for tuning in. If you're providing support to a loved one, you don't have to do this alone. Asking for help is not a sign of weakness, it's a sign of strength. To connect to our programs and services, visit our website at scrc.care or call us at 1-800-827-1008. If you live outside of San Diego and Imperial counties, visit caregivercalifornia.org to connect to the closest caregiver resource center in your area. To support our efforts and make a tax-deductible donation, please go to scrc.care and click on the Donate tab. And remember, SCRC is here for you,
caring for those who care for others.